It's hard to see any behavioral symptoms. Now, there are a few little indications using some paradigms that you can see some subtle difficulties, but for the most part, most kids don't show symptoms at 6 months of age. But between 6 and 11 months, you start to see a whole range of symptoms emerging for those kids with early onset. And by 12 months of age, we start to see delayed gesture, language, poor social imitation, and by 18 months of age, the full syndrome has emerged. Now, another way of trying to understand risk for autism is to use electrophysiological indicators. And the idea here is that by the time we see behavioral changes, this is a far down the road of when brain development has gone off the normal developmental trajectory. And that we might be able to pick up on indicators of risk for autism by studying the underlying biology using neuroimaging techniques. Where we could pick up babies even before the symptoms are present. So when we started this work, we capitalized on work that we had done at the University of Washington with my colleagues, where we used event-related brain potentials, where we were looking at the brain's response. This is young children with autism, diagnosed with autism now at about 3 to 4 years of age. And we looked at their neural response to faces as compared to toys, so objects. And what we showed is that by 3 to 4 months of age, and then later in studies of even 2-year-olds, 18 to 24 months, that children with autism have an atypical response to faces that can be seen in their event-related potential. We also showed similar effects in terms of the brain response to speech phonemes. So the differentiation in your brain's response to hearing ba versus pa, that you can see differences, and this actually correlates with whether the child will go on to have a significant language impairment.